wanted to tell you that I was transgender, which means that I was a boy, but I became a girl. So I have a girl brain, but a male body.
Jazz Jennings is probably the best example of what a trans kid is, because it's clear that Jazz was exploited by her parents to become a trans kid and star in a reality show that focuses entirely on the fact that Jazz is transgender. But what exactly is a trans kid? Is it a little boy or little girl that tells you that they're the opposite sex? Is it when a kid tells you that they don't feel comfortable in their body? Is it when a boy tells you they prefer to wear a dress? Or when a girl prefers to hang out with a group of boys over a group of girls and rejects being feminine? And how exactly do you know for a fact that your child is a trans kid? And what do you do when you figure that out? But how do you figure that out?
Somebody ring the bell again.
The day that Jackie told me that she was not happy being a boy, we stopped off at Walgreens. I told Jackie that she could pick out something special. So Jackie picked up these little elastic hair bands and said, "We need these."
Because there is no transitioning from one sex to another. And you have to wonder, at what point does a parent realize this might not be it? And should Jazz ever grow up to at some point maybe regret transition and want to come out to identify as their biological sex? How could that at all be possible at this point when in fact their entire body has been feminized to appear like the opposite sex, even though it is not exactly like the opposite sex? It is a male that has feminized their appearance to pass in society as being a woman. And we're often told that if you don't affirm a kid, they're going to kill themselves. But what sort of mental state is a child in to want to kill themselves because they're not in the right body? And if that child thinks that they're in the wrong body for a variety of different reasons, but we assume it's just dysphoria, and that child later grows up to regret that they ever transitioned, and they want to reverse everything they've done to their body, which is impossible because a huge part of transition is irreversible, well, now what? Well, that isn't an option for a trans kid, is it? Because when you as an adult decide that this child knows exactly what they want for the rest of their life, you take that from them. You rob them of having that choice.
A few moments later, the boy responds, obviously confused.
He just sent me, but you have a girl body, right?
That's a very difficult question to ask. Why don't you tell him to watch the videos first?
Jazz texts him back to watch this online video of her, hoping it will help him to understand.
And I think like a girl, but I just have a boy body.
What does it even mean to think like a girl? And even more importantly, where did Jazz get this idea? These aren't thoughts that dysphoric kids just naturally have. They're ideas that adults plant in a child's head. For example, when I was growing up, I was dysphoric, but I never said that I think like a boy, that I have a boy brain. You know why? Because gender ideology wasn't a thing when I was growing up. These ideas weren't commonly thrown around. Now, I like to think that every parent is trying to do their best for their child, but some parents do exploit their kids and have their own set of issues, and therefore they can't see what they're doing to their child, which might cause them to not notice, to not see the harm that they might be causing their child.
This one is Time to Thrive, and it's for people who work with LGBTQ youth. We actually go and meet with our senators and representatives. After we do that, we go and sit and sell some of Avery's books for a little while. Avery, manners.
I just don't want to even have a book. I've done too much in this world. It's ruined my life enough, and now everyone in this world is going to know. If I sell my book, it's going to go on the news along with me for like the 50th time at this point, and it's just going to make my life worse.
A couple years ago, you wanted people to know.
Yeah, I did, but now that was really stupid, silly mistake, and now I don't.
It is not easier to create a trans kid, because once you've committed to having a trans kid, not only are you committing to making your child a medical patient, but you have to constantly work at detaching them from reality. Now, what do I mean by that? Telling them that they have a boy brain or girl brain. Telling them that they were born in the wrong body. Telling them that they have a female or male body despite the fact that their sex says otherwise. Telling them that it's possible for a man to become a woman and for a woman to become a man. And telling them that if anybody questions this, it's transphobic.
Jazz is 11, on the verge of puberty. For a boy who wants to be a girl, that must be a disaster. Change of voice, facial hair.
It can be a disaster. Any little girl does not want to develop a beard, low voice, and we have done something about that.
Notice how they said, we have done something about that, because they have. They're the parents. They decided that this is the path for Jazz. Jazz didn't decide that because children cannot consent.
Jazz is on hormone blockers.
This is day one of me on the blockers.
First given as a shot,
Relax, relax, relax.
then as a pump inserted into her arm.
Alright, so let's take a quick look at Lupron, which is a puberty blocker that is prescribed to treat dysphoria in children, who, by the way, again, might have dysphoria for a variety of different reasons, might have a bunch of comorbidities, and none of that matters because, you know what, if your child says, I feel like I'm trapped in the wrong body, affirm them, or you're transphobic. What is the drug Lupron and why is it prescribed to kids? Technically, Lupron is a gonadotropin-releasing hormone agonist used to treat prostate cancer, breast cancer, endometriosis, and uterine fibroids. It has also been used in the past to chemically castrate pedophiles. It is now being used off-label, having never been approved by the FDA or Health Canada, to stop puberty in kids who want to change their sex. It stops the production of testosterone in boys and estrogen in girls. Because of this, their bodies do not develop their sex-based characteristics. Girls' breasts won't grow, their hips won't widen, sex organs won't develop. And one of the side effects is that children suffer bone loss. A young girl in Sweden just suffered spinal fractures, is in chronic pain, and has osteopenia because of taking Lupron for 3 years. Virtually all of these children have other mental health comorbidities going on, and the children growing up at the gender clinics today do not have traditional gender dysphoria that starts from a very young age. Keep in mind this article is from May of this year, and things have changed with the FDA, which we will get into later on.
It didn't hurt as much as I thought it would.
The medication stops testosterone from entering her body, essentially pausing her natural male development.
She has no detectable testosterone in her system right now.
Zero? Wow.
Take a look at this. Children's Hospital London Health Services says gender pathway service, Lupron. Okay, let's see the information here. So they give you the recommended start dose, and then it gives you further information. The following should be discussed with patients and families. The importance of the injection, if the patient is not able to attend the appointment for 4 weeks. The potential release of hormones after the first injection leading to a mild advancement of puberty. This may lead to spot bleeding or a period. So obviously this is specifically for females. After the second injection, hormone production should be completely shut down. That is a really disturbing sentence to read. You want to shut down a child's natural puberty. Just completely shut it down. What do you think might happen if you do that?
This approach to treating folks with gender dysphoria, this gender affirmation therapy, and in particular, and then the application of the medical arm of the Dutch protocol, which is puberty blockade at Tanner stage 2, early puberty, followed by cross-sex hormones, and then potentially sex reassignment surgery. So that is completely unproven in children and adolescents. Unstudied, unproven, very dangerous, given the side effects of these hormones. And in addition, the application of that protocol because most gender dysphoria resolves. So most kids
by
with
age
gender
20,
dysphoria,
you say?
Yeah,
80%.
That's what the literature says. So regardless of source, this has been well established back to probably 1995. And again, we're talking right now about childhood gender dysphoria. So 80 to 90% of kids who have gender dysphoria will have resolution of that as they pass through puberty. That's not been well studied. We don't know the process by which that occurs, but we do know through puberty, the majority will resolve. So if you apply a protocol of puberty blockade, so affirmation, puberty blockade, and cross-sex hormones to every kid who's coming into puberty, you essentially are going to treat many who would have resolution of their gender dysphoria. And that's another major, obvious problem.
I can't imagine it's good things. Families should be in touch with their health care provider if the child experiences continued bleeding. Stiffness in the muscle after injection is common. No need to cancel physical activities. If patient is sexually active, encourage use of condoms because Lupron does not provide protection from STIs. Lupron does not provide complete protection from pregnancy. So that is that. Let's see what else we got down here. Side effects. About 5% of patients experience a sterile abscess at the site of the injection. This can present similar to infection. The fluid may not be drained. We suggest they return to their primary care provider or go to their local clinic. Patient may experience menopausal symptoms. Now, I just gave you a brief history of Lupron, what the drug was used for, and what it could cause. At any point, did they include all of the information, the necessary information, for parents to decide whether or not it's worth giving their child puberty blockers to treat dysphoria? There's no mention of bone loss, possible brain tumors, vision loss, osteoporosis. That's another issue, right? These kids that are at the age of 13 to 14, their bone loss is so bad, they're now like trapped in the body of an 80-year-old. No mention of that.
They block any facial hair I might get or armpit hair, maybe, like just so I don't look like a boy, or even getting a deep voice also.
Notice how Jazz had nothing to say about any health concerns because she's a kid. Why would she be concerned about that? This Reddit post is from a 16-year-old girl. They write, I'm 16. I'm assigned female at birth, and I've been in the trans community since I'm 12. People always telling me I'm trans. And I'm going to read that line one more time. I've been in the trans community since I'm 12. People always telling me I'm trans. And it's like I said earlier in this video, you plant ideas in a kid's head, a kid will start to believe it. This isn't something that a kid just comes up with. No one thinks I'm trans at the age of 2 or 5. Kids might be dysphoric, but they don't know what the hell's going on until an adult tells them what's going on, until you convince them that they're in the wrong body, that they are trans, whatever the hell that even means today. And they go on to say, but recently I thought about it, so I'll make a list about why I would be trans and why I wouldn't. Reasons why I would be trans. I like masculine clothes. I have a masculine passing. I have some masculine hobbies like video games. I have no problem with masculine pronouns and stuff. Let's pause there. Everything this girl just said is based on stereotypes. Masculine clothes? Well, what do you mean? Is a t-shirt always masculine, or can it not be feminine? And also, if it is feminine and a guy wears it, does that mean that he's a girl? If a girl wears a very masculine looking shirt, is she now a boy? Did her sex just change? No, of course not. These are stereotypes. And this is why, just like Jazz, these kids think that they're trans because of stereotypes. And instead of getting pushback from adults that should be telling them to accept their body, to accept who they are, to, embrace the fact that you're a masculine girl or feminine boy, what they're getting instead is, have you considered that you're trans? Now let's read reasons why I wouldn't be trans. I have dysphoria. I don't know if it's the right term about my body not being as feminine as other females. My born name and feminine pronouns doesn't really bother me. Does that sound like a reason to get surgery to completely change everything about your body? Because it sure as hell doesn't to me.
Jazz is 100% girl.
That's not true. We know that's not true. And maybe it wasn't common back then for a doctor to sound as deluded as this man does, but it is now. The way he's speaking is commonly seen among therapists, surgeons, so-called experts. They say this to the parents and to the child, just flat out lying to them, because we know that you cannot change sex. We are not clownfish.
How's your sight? And there's absolutely no doubt in my mind that they've done the right thing.
But how is there no doubt in his mind when the quality of evidence in the science is really low? And over time, what we've seen with these so-called experts is a change in their attitude, because they've come to realize that the science isn't there, or because they're starting to see a pushback and they want to save their own ass. Like, for example, Dr. Marcy Bowers.
Every single child or adolescent who is truly blocked at Tanner stage 2 has never experienced orgasm. I mean, it's really about zero. These are just assigned male at birth, so trans feminine, and it's because they never in their lives are exposed to testosterone. That doesn't change. So blockers prevent the rise of testosterone, and they don't really go on testosterone at or around surgery or into adulthood. And so we don't know. They're going to have this sensation. There's no question about that. But are they going to be able to achieve sexual satisfaction? it's important in relationships. And I know that from my work with female genital mutilation survivors, that the lack of being able to be intimate with a partner is very important. And so this is what really raised the red flag for me, is to say, look, we need to have our eyes open about it. I think it's been beneficial talking about it. I know Joe and many others have reported to me, they've changed their approach a little bit in their informed consent models, and that we're talking about masturbation now. We're talking about, okay, that's an area of the body that's got very dysphoric for you, but you know what? It's all a penis is just a large clitoris. I mean, it's all the same material. It really is. So use it for the pleasurable purposes, partially that it was intended, and we'll see what happens. But these are to be answered questions. So can we avoid puberty and get good adult results? And secondly, how do we assure someone that they're going to be able to be sexually responsive? Do we remove the blockers during the course of their adolescence and let a little bit of puberty come back? Do we delay it a little bit, maybe into Tanner's 3 or 4, maybe before they have their first orgasms, maybe?
And how exactly do you know that it's the right thing when children change their minds all the time, have no idea who they are, and cannot consent to medical treatment that comes with permanent, irreversible changes? Sweden's Karolinska ends all use of puberty blockers and cross-sex hormones for minors outside of clinical studies. According to the Dutch protocol, which has gained popularity in recent years, gender dysphoric minors are treated with puberty blockers at age 12, and in some interpretations, upon reaching Tanner stage age 2 of puberty, which in girls can occur at age 8, and cross-sex hormones at the age of 16. This approach, also known as medical affirmation, has been endorsed by the WPATH Standards of Care 7 guideline. In recent months, several countries' health authorities found that the evidence base is insufficient to justify routine early medical interventions for gender dysphoric minors. Finland revised its treatment guidelines in June 2020, prioritizing psychological interventions and support over medical interventions, particularly for youth with post-pubertal onset of gender dysphoria, currently the most common presentation. Significant changes are also underway in the UK. Following the 2020 High Court judgment, the NHS, National Health Service, suspended the initiation of hormonal interventions to minors under 16. The ruling is currently under appeal, with a hearing scheduled for June 2021. Early in this video, I made it clear that these drugs are experimental for the treatment of dysphoria, and I gave you a little history on what they were used for, and it's no surprise that this is all changing, because the evidence isn't there. A few days ago, I learned that the Tavistock in the UK is going to shut down the clinic by spring after it was criticized because they found that the model of care was leaving young people at considerable risk of poor mental health and distress, and having one clinic was not a safe or viable long-term option. And it goes on to say they will aim to help support young people under the age of 18 who are struggling with their gender identity and be linked to mental health care and GP services where relevant. But I guess the good news is that in the United States, they have finally decided to put a warning label on puberty blockers. Puberty blockers earned a warning label from the Food and Drug Administration earlier this month after 6 minors between ages of 5 through 12 experienced severe symptoms. And they talk about what those effects were in the minors, who were all biologically female. It states that they suffered from symptoms of tumor-like masses in the brain, vision disturbances, headache, vomiting, swelling of the optic nerve, increased blood pressure, and eye paralysis. And this is the one way to treat dysphoria that parents are being told is safe.
Dr. Will Charlton is Jazz's doctor. With her development on pause, the next big decision is if and when to give her estrogen, the female hormone that will allow Jazz to grow breasts, prevent facial hair, and redistribute her body fat, giving her a curved feminine shape. But the cross-hormone therapy is irreversible. But once Jazz begins taking estrogen, she will be permanently infertile. At 11 years old, do you think at all about being sterile and not having your biological children?
You shouldn't have to. She wants to have a baby of her own.
But she can't.
She knows she can't. It's probably one of the things that upsets her the most.
How a person feels about having kids and getting married and other things in life changes over time. You might not think about it at all in your childhood or your teen years. Maybe in your 20s you get this burning desire to have a kid. That changes. We know this because it happens quite frequently with detransitioners, especially female detransitioners. They later on go to regret their transition, and they talk about the loss in not being able to have a child of their own and not being able to breastfeed and other things. So if this is something that over time changes and we're not too sure about it, then why again are adults deciding this for a child? Because asking a child at the age of 8 or 10 whether or not they're okay with maybe never having kids of their own because they would have to have it in a biological way that they don't feel comfortable with, you're going to get a very careless answer because they're still a kid. When they grow up, you might get a different answer. You might get a full in-depth answer to how they feel about having kids and not having kids.
Taking Jazz on as a patient for surgery, we knew it was going to be a one-of-a-kind surgery. She's one of the first to have undergone complete pubertal suppression.
The surgeon just told us that she's one of the first. And what should that tell you? That it is high risk, that it is an experiment, that they're operating on Jazz not knowing what the outcome could be. But obviously, to anyone with a brain, there is going to be a complication.
And lack of growth of the skin and other tissues, which we rely on as surgeons to do this operation. And we don't have the experience of having said we've done 50 of these. I was just not expecting her to have a complication as severe as what she did have.
We're not doctors, but we've had a chance to actually view what went on in the OR during Jazz's first surgery, and it's pretty disconcerting in certain ways. It's like, whoa, this is what occurs while Jazz is having her surgery, and the doctors sometimes don't see eye to eye.
Why are you cutting there?
Right here?
Yeah, why?
Because it's scar, Jess. I don't like it.
Yeah, but there's scar everywhere. If you don't have to cut this, why would you cut that?
So they're experimenting on your child. They don't seem like they know what they're doing. That's exactly what trans healthcare is.
Okay, so we're all done. Number one, it was the right decision to do this. Because as we were getting her on the bed, I felt something go pop.
Oh my goodness.
And she said, oh, that doesn't feel good. And then when I looked, the whole thing had just split open. So if we hadn't done it today in the OR, it would have happened in the hotel.
Oh my
Maybe
goodness.
tomorrow.
No doubt this will be overlooked as being not a big deal to the Jack Turbans of the community and other trans activist surgeons and doctors and experts, because they'll probably say things like, but complications can happen to people that get all kinds of surgeries, and the amount of complications we get aren't that many. We get a lot more positive outcomes than the negative ones. Sure.
For the first time in history, a marginalized group has a huge dollar sign on the top of their head. We have 5 children's hospitals in the United States promoting that.
What?
That's a phalloplasty. That's a bottom surgery. We have 5 children's hospitals in the United States telling girls that they can be boys at $70,000 a pop in a surgery that has a 67% complication rate. That will kill me from infection that I can't sue on. We're butchering a generation of children because nobody's willing to talk about anything. I have 3 kids. At the age that they're doing this to kids, I'm not transphobic. I love my kids, and I love other people's kids, and you should too. This is wrong on so many levels.
But in an article with People magazine, Jazz talked about how her libido is still basically nowhere. She's never had an orgasm, and she's very concerned that she may never have an orgasm. And you might be wondering, why? What happened? Puberty blockers. That's what happened.
It doesn't make any sense. Why do you need to cut that?
Because this is a disfiguring scar.
How do you know it's not a disfiguring scar? That's just a sulcus. These are the 2 labia. I mean, you may be right, but we don't know.
Jess,
why don't we just open this up and then see what this looks like?
Let me go, Jess. Let me go.
They don't know what they're doing. They can't agree. But hey, doesn't matter. Trans healthcare. This is it right here. And as it turns out, what really matters is what it looks like afterwards.
Picture too. Poor thing. You could be a porn star for all the photos are taken.
Instead of wearing a shirt that says protect trans kid, think about what you're supporting.
This is Ari, Gwendolyn, and Brynnifer. They are in a polyamorous relationship, and they all parent Hazel and Sparrow.
We have a 2-year-old antigender baby and a 10-year-old who is non-binary.
They have chosen not to disclose Sparrow's gender.
We don't know it yet. It's something that Sparrow's going to have to figure out and then tell us.
Please tell us how and why you decided to come out as non-binary.
Because the pronouns she and he did not fit. Non-binary was what I turned to, though I do choose to act and look more feminine.
Can I go down now?
Of course.
And 2.5-year-old Sparrow has yet to make a choice about their gender.
Because it's not kids with dysphoria. You're supporting the trans activism that is directly causing harm to dysphoric children. And if you're a parent and you think that your child is dysphoric or is saying that they might be trans, think about your next step. Because it's up to you as a parent to protect your kids. Not teachers, not the government, and not doctors. You as the parent. You shouldn't fight your kid if your kid has dysphoria. You shouldn't reject that they are gender nonconforming. But you shouldn't also celebrate it. If you have a little boy who prefers to wear a dress, it shouldn't be a celebration, because once you celebrate it, it becomes their everything, their identity. But you also shouldn't cause them shame, because if you cause them to hate the fact that they're a feminine boy, they'll grow up to be uncomfortable in their body and consider being a transgender woman instead. I don't have a perfect solution for parents because I don't know. We're still trying to figure this out. But what I do know is that kids can't consent, and trans healthcare doesn't care about your child.
In my own little corner, in my own little chair, I can be whatever I want to be. On the wings of my fancy, I can fly anywhere, and the world will open their arms to me.